good evening to everyone, and those who found the time to actually join us this evening. And I hope that at the end of my talk that you're actually blessed. I'm a consultant breast surgeon, and I have worked as a consultant surgeon for more than 10 years now. I mainly work in the UK, helping with patients in Nigeria. Breast cancer, it's really very common, and I think it's something we all should know about. Majority of my patients are women. I mean, the last decade, I have 3 cancers a year, and majority of them are women. I can count only about 5 men that I've actually treated over the last 10 years. Despite that, it's still very, very important. And I would use my slide to actually explain to you the reason why it's important for men, particularly this month of awareness, to know about breast cancer. It's useful for you as a person, and also it might be useful for relatives, wives, partners, daughters, mother. The more you know, the better it is for you. So men get breast cancer too. It's not a disease which is entirely or solely only women. So you need to be aware. Now, in the UK, as an example, we treat about 55,900 cancers a year. But majority of patients we treat are women. But as you can see, my slide, the year, I'm talking about the whole of the UK. Although it's not a disease that is common in men, it's still some when it affects you and when to actually seek help. The next slide, if you look on top right, you see that about more than 11,000 women die every year as a result of breast cancer, and only about 86 or thereabout men die every year directly related to breast cancer. So essentially what I'm telling you with these 2 slides is, although it's something we see in men, it's not as common as ischemic heart disease or bowel cancer or prostate cancer. But if it's caught very early, it's something which can be easily cured. Now, before I go further, I'd like to show you basically what the chest of a male person looks like, i.e. the structure. For a man, simply what men have is a nipple. With the nipple, you also have the chest wall skin, and behind it, 90% of the time is just fatty tissue, which you have in men. Behind that fatty tissue, you have the pectoralis major muscle and the pectoralis minor muscle before you come to the ribs and then the intercostal muscle. Some men who are very sporty, who are well-developed, will have well-developed muscle, and then they have a very big chest wall, and it can push the nipple forward a little bit. Whereas some men who are generally just fat would have that constituting majority of the breast tissue they have. So that is what it's supposed to look like in a normal person. Now, if any man, if you touch your chest wall, all you should be able to feel is the nipple. If you can feel something else apart from the nipple, then it might be that you've developed breast. And I have pictures still to share with you to actually explain that to you further. Now, so that's the normal structure. That's what you expect if you actually slice through a male patient. Rarely men do develop cancer. 99% of men who develop breast cancer, it's usually behind the nipple, but it could be in other parts of the chest wall, depending on where they've developed the cancer. It's very unusual, and men tend to present late because they don't have a lot of tissue there, and quite quickly is sitting on top of the chest wall, and might not cause them any problem apart from balance before they realize that there is a problem. Now, you can compare what the structure of a woman looks like. Now, this is the anatomy or the structure of a woman, and you can see that in women, on top of the chest wall muscle, the pectoralis muscle, they have a lot more fats, which makes up the breast, and they have lobules. Now, it depends on the age. At a very young age, there are more lobules, and when a woman becomes pregnant, it's actually the lobules that produces the milk. The milk drains out via ducts and comes out through the nipple. When women become menopausal, the lobules then regress because of the female hormone goes down. The lobules can still produce fluid, and that's why some women have what is called nipple discharge. Now, men rarely sometimes can develop small amounts of breast tissue. It could be intentional, it could be unintentional. Now, what is cancer? Essentially, if you see the top of my slide, that's supposed to be normal. Within the breast tissue, in my previous slide, I showed you breast ducts. And the breast duct, inside of the breast duct, you have normal tissue that actually lines the ducts. That's what it's supposed to be like. Like any cancer, it starts by the cell becoming autonomous and losing control. There's what is termed apoptosis. Normally, like the skin will grow and reach a certain size, and when the time is right, the cell will die and then will be replaced by a new one. But cancer, because it's autonomous, continues to divide. The second slide shows you here where the tissue is become quite enlarged. Eventually, what then happens with invasive cancer is that it breaks through what's called the basement membrane. It's like if you have a foundation, the foundation holds the house. But if there is a problem, and then maybe water passes through or breaks down the foundation, then it becomes malignant. And the reason why this is dangerous is because cancer can actually overgrow where it starts. It can then leave where it starts and go to other parts of the body. It can go to the brain, it can go to the lungs, it can go to the spine, it can go to the liver. It then overwhelms that organ and then prevents that organ from doing what it's supposed to do. And that's the danger with any cancer, just like breast cancer can do. Now, what are the risk factors? Because there are not so many men developing breast cancer, all my patients that I've treated with breast cancer, all of them were over the age of 60. So the risk factor, the greatest risk factor is actually age. Breast cancer is not something we see in young men. Majority of men who develop breast cancer also will have a family history. And what I mean by that is majority of them might have either the mother or sisters or daughters or even grandmother who's actually developed breast cancer. Another risk factor is if a man has a brother who's developed breast cancer, it's very uncommon. They need to be checked. Another risk factor is also having whether male or female relatives with bilateral breast cancer and ovarian cancer. There's a condition called Klinefelter syndrome. This condition, the men who actually have more than one X chromosome, they tend to be infertile and they are at very great risk of developing breast cancer also. A lot of men who also develop breast cancer will have what's called the BRCA gene mutation. I'm not sure if you've heard about this, but in women, it also accounts for about 5% of all the breast cancers we see. The last risk factor I have here is radiation treatment. Now, in the past, even up till today, some people develop a lymphoma at a very early age and they have whole body radiation. Over 2-3 decades, they're actually at higher risk of also developing breast cancer. Now, what are the symptoms? How can you know that something is wrong and you need to be checked? If a man suddenly feels a lump behind the nipple, which is painless, it's not because they've had any trauma, then it needs to be checked because it's very, very unusual. As I said previously, for a man, if you examine yourself, all you should be able to feel is just the nipple. If you can feel a lump behind your nipple, then you need to be checked by your general practitioner. If a man notices a change in the size or shape of the chest wall, or if they notice puckering or dimpling of the skin, then it's something to be attended to. Some people would notice a change in the color of their skin, and I'm talking about redness. Now, this sort of redness is not because of infection, because if it is, then if you have antibiotics, the color should go back to normal. But if you have antibiotics for about a week or two, and the redness doesn't get any better, it's another thing to be checked for. Nipple rash, which I'll show you pictures of, or bloody nipple discharge, is another common symptom of breast cancer. Nipple retraction, when the nipple is pulled in awkwardly, could be a sign of breast cancer. Now, unlike men, a small proportion, about 30% of women who develop breast cancer nowadays have no symptom at all, and they're regarded as asymptomatic. These women tend to have very small cancers and they're picked up on a breast screening program. Some men might be lucky, or they might have a family history. They might actually have been assessed in the past. And if they know they have the BRCA gene mutation, then they can be followed up, and early breast cancer can also be picked in men this way. Now, this is an example of male breast cancer. And you can see typically here that the whole chest wall is swollen. But the most important bit is the nipple. The nipple is pulled in. It's not out. It's not erect. These patients, if you examine yourself here, you'll be able to feel a lump behind here. And if there's no history of trauma and this persists for more than a week, then the person would need to be seen by the general practitioner. Now, some people might not know that something is gone wrong. And like this other patient with a right breast abnormality, it's now become locally advanced. There's a subtle change beyond the nipple. There is a lump behind there, and it's because of the cancer. And if you also look towards the armpit on the right side, you can see the skin pulled in here. It's because the patient has developed lymph node, most likely because the cancer is spread to the lymph node, and it's the usual place breast cancer will spread to first. If the patient doesn't know that there's something wrong at this particular stage, it can then progress where you'll have something as nasty like this. But luckily, we've gone far beyond situations like this, with people having very necrotic ulcerating lesion before they realize that something is gone wrong. Now, this is a very big gentleman who's had left breast cancer, and in actual fact, he's had the cancer excised, and that is why he has this scar around the nipple. You might not be able to see very well, but he's also wearing a corset on his left upper arm. And that's because he's had axillary surgery, most likely because this patient had lymph nodes involved, cancer. But a lot of men, instead of having breast cancer, they develop a breast board. And breast in men is called gynecomastia. Gynecomastia. Majority of breast in men is idiopathic, which essentially means we don't have a reason for it apart from age. 80% of men over the age of 80 will have a small amount of breast tissue. But younger men who develop breast could be as a result of liver disease. This could be as a result of excessive amount of alcohol use. But the next one is testicular cancer. And this is important for any young person under the age of 40. Any young man who develops breast tissue under the age of 40 needs to be checked, and it needs to be made clear that they don't have testicular cancer. The use of cocaine, heroin, and smoking of marijuana can also cause men to grow breast. There's certain drugs, the side effect of which can cause breast development. It can be as a result of having prostate enlargement, which is not treated, or even treatment of prostate cancer. Development in men is not a precursor for developing breast cancer. It's a benign breast condition. But you can see the picture here on my right-hand side. This is a breast, and this is a male patient. The same on the left-hand side, but this is a smaller one. And now this picture of this gentleman who's developed breast. If you remember the picture I showed you about the man with the breast cancer, you can see that it's actually quite different. This condition is called gynecomastia, and this is a popular American actor who actually developed gynecomastia as a result of testicular cancer. The common drugs that can cause men to develop development of breast include anabolic steroids. A lot of sports people who want to develop them also use anabolic steroids. It can also be as a result of prolonged use of omeprazole and cimetidine for peptic ulcer disease. HIV medication also can cause development of gynecomastia. Certain blood pressure tablets like verapamil and nifedipine can also cause gynecomastia. I mentioned earlier on about heroin, methadone, cocaine, and smoking of marijuana. It can also cause gynecomastia. Estrogen is a female hormone, and men who want to transition to become a woman, quite commonly, this is the drug which you give them to develop breast tissue. Stilbestrol was used in women who were pregnant in good old days. If it's used in men for other purposes, it can cause gynecomastia. Spironolactone is another drug which is still commonly used nowadays. It's a diuretic. A side effect of it is that it can cause gynecomastia. And the psychiatrists also use a drug called risperidone, which can also result in men developing breast tissue. But all this will cause benign breast tissue, but not breast cancer. It's very important for any man who develops breast tissue to actually have it checked and ensure it's not something sinister. Now, when a man develops a lump, which is sinister, which is not gynecomastia that I described, you can see here, this is the mammogram, which shows a lump in the left breast. And you can see this is the nipple, which is pulled in. Typically, if you go to your general practitioner, they'll take a history. You'll have a discussion with your general practitioner about what happened, and then they'll refer you to the hospital. In the hospital, we'll have a chat with you, and then we'll examine you. And if you can feel a lump, then we'll send you for mammogram, which is X-ray of the breast. In the UK, women have the same kind of test, but even those who have no breast lump, when they get to the age of 50 and 70, they have national breast screening program. So a man with a breast lump, most likely over the age of 40, will have a mammogram first. And the next thing is they'll have another type of scan called ultrasound scan. Now, while having the ultrasound scan, this is a needle going into the lump. A biopsy will be taken. The biopsy will be sent to the lab, and the histopathologist would look at it, and they can always confirm if it's cancer, if it's any lump in a man causing the nipple to retract this way, will invariably would be breast cancer. I hope you can all hear me. Now, this is a mammogram which is performed in women, and you can see this is just normal mammogram. And just to show you what women have to have if they have any concerns with their breast. Now, how do we treat breast cancer? Although breast cancer is very common and it's common all over the world, it affects all races. It's not something that just affects one particular race over the other. What we've also noticed in hospital and the epidemiology of breast cancer is that it's actually slightly changed now. Breast cancer is increasing in men. It's also increasing in Black women, particularly those under the age of 60. The world is becoming a very small place. So something has happened, which we're not 100% certain yet. And it's a reason why both, whether you're Black, white, or anything, you need to know about your breast. Now, majority of patients who are diagnosed with breast cancer would have surgery. The aim of the surgery is to be able to remove the whole cancer. If the cancer is stuck onto the chest wall muscle, or if it's gone to other parts of the body, like the bone or the liver or to the lungs, then it's actually not curable. And in that case, yes, the patient can still have surgery, but it will be palliative. The other forms of treatment we use is chemotherapy. Only a small proportion of patients with breast cancer, particularly men, will end up having chemotherapy. Those who have chemotherapy are those who have a very big cancer, high-grade cancer like grade 3 cancer, or other high-risk factors like what's called HER2 receptor positive cancer. Radiotherapy is also given to about 80% of patients when they've had surgery for breast cancer. 80% of patients who've had breast cancer, including men, would also have what's called hormone therapy. And a common example that most people are aware of is a drug called tamoxifen. Now, that's because 80% of breast cancer are what's called estrogen receptor positive cancer. A small proportion of breast cancer would be very aggressive, about 15 to 20%, and a molecular marker is done called HER2 receptor status, and those patients will have a drug called Herceptin. The drug is given by injection, 18 lots of injection given with chemotherapy over a year. We also use complementary therapy to treat patients with breast cancer, because quite commonly the drug hormonal therapy tamoxifen causes menopausal symptoms, and it can cause the same thing in men. So complementary therapy tends to help with that. This is a lady I operated on about 10 years ago, and she had cancer in her right breast. I'm just showing you what's possible, because we haven't reached the stage where men require reconstruction, but this lady had a mastectomy of the right breast, and I performed the mastectomy and reconstructed her breast using an implant. She has a false nipple on the right side, and it's the same lady you can see wearing a bra on the right side. Again, this is another example of another lady with very large left breast cancer who had a mastectomy and then performed what's called latissimus dorsi reconstruction and reduced the size of her breast to match. And that's her when she's dressed. Now, this is the most important part of my presentation, and I'd like to leave you with this. And the idea is, even for men, it's a good idea for you to examine yourself, for you to know what your breast actually feels like. If you do it once a month or once every 6 months is actually adequate, and it's something which you can easily do. It's a case of knowing yourself. Have a look at yourself in the mirror. Make sure that the nipples are pointing in the right direction. Then raise both hands up. If the nipple suddenly gets pulled in like the previous slide that I showed you, then you have a feel. And essentially what you need to do is the flat of your hand, the flat of the hand here with soap or cream, you just go up and down along your chest wall. If you can feel anything like a stone, like a pebble, then maybe you have a lump, and then it needs to be checked out. It's so easy, breast cancer lump, because it feels different. It feels hard. It's unusual, and it will pull the nipple in. It would invariably pull the nipple in. How can you reduce your risk? How can you reduce your risk of developing breast cancer? Excessive amount of alcohol is being shown equivocally to increase the risk of breast cancer. It's also good to maintain a healthy weight, to keep physically active, and also to know your family history. If you have a sister, a first-degree relative under the age of 40 who's developed breast cancer, then you need to find out about the family. If there's history of ovarian cancer, then it might be worthwhile actually to get a literature from your GP about genetic linked breast cancer. Now, in conclusion, I would like to repeat myself and say breast cancer, although this is Men Awareness Week, you need to know yourself. Health is wealth. People perish because of lack of knowledge. Breast cancer is not common in men. Only about 370 seen in the UK. Majority of them is just bad luck. It's sporadic. But a small proportion will have genetic mutation. If you feel something has changed and it doesn't get better after 2 weeks, then obviously you need to see your general practitioner who will be able to examine you. And it's very, very easy to actually make a diagnosis of either gynecomastia or breast cancer in a male patient. Thank you very much.
Thank you so much, Dr. Bumi. Is there any questions for Dr. Bumi? So the main symptoms for breast cancer in men is a lump in the breast. That's what he said. Huh?
That's right. Yes.
And you also mentioned that it's not common in men. Yeah, sorry.
No, it's not. It's not common in men. Typically, the lump will be behind the nipple.
The nipple. Okay, thank you so much. And as I said, you mentioned that it's not common in men. You said so far about 370 men in the UK have been diagnosed.
Every year.
Every year also. Thank you very much. And thank you so much. And you mentioned some of the symptoms. You mentioned lump, change in color, nipple rash, nipple discharge. And if any of these happened, you recommend that men should check with their GP. Is that right?
That's very correct, yes. Although the commonest symptom is a painless lump, but all these other things can happen. I mean, obviously, anyone who has bloody nipple discharge needs to get that checked.
Can I just ask a question, Dr. Bummy? So normally if you have breast cancer, is it normally affecting both breasts, or could it just affect one?
Okay, so I mean, because there are not so many men developing breast cancer, we just have to extrapolate from the women who develop breast cancer. Bilateral breast cancer affecting both breasts is uncommon. It only affects about 5% of women. So it's not as if it's unheard of, but it's very unusual. I haven't come across a man with bilateral breast cancer, but it's not impossible. So those who have BRCA gene mutation, they have up to 80% risk of developing breast cancer and also prostate cancer. And in those ones, the risk of developing bilateral breast cancer is very high.
Okay, thank you so much. Shola has asked in the chat, why is breast cancer less common in men?
Essentially, it's because men don't have breasts. And if you actually look at the evolutionary trends, i.e., if you look at animals, it's only in human that women have breasts when they're not breastfeeding. If you look at the chimps and the gorillas, they only have breasts when they're actually pregnant or breastfeeding, and then it becomes redundant. So men typically don't have any breast tissue, and the estrogen level in men is really low compared to women. The reason why some women develop breast cancer, not that we're 100% certain, but those are the factors, those are the kind of things that would lead to breast cancer, as I mentioned earlier.
Thank you so much, Mr. Bummy. Another question is, what about fatality when it comes to men developing breast cancer? Is it high risk?
Well, no, it's not any worse for men than it is for women. The only problem that arises with men is because it's so uncommon and people neglect the cancer for so long. And also because men don't have a lot of breast tissue. Once the lump sits on top of the chest wall for a long time, then it can quickly spread to the lymph node. But if the man is attended to quite quickly, the outcome is actually excellent.
Thank you so much. Here's another question. To what extent is alcohol consumption linkable to breast cancer in men?
Okay, so
that's from Tony.
Okay, I'm talking of excessive amount of alcohol. Excessive in that it can cause liver disease. Because the liver is one major organ within the body, it's the organ that actually metabolizes the hormone within the body. For men, testosterone comes from the testicles, but it's metabolized in the liver. So excessive amount of alcohol causes obesity, it causes immobility, and gradually it can cause development of breast tissue or even breast cancer.
Thank you so much. And another question from Shola, which gene increases the risk of breast cancer in men? Okay,
so it's the same gene as
very good questions.
It's the same kind of gene as you have with women. It's called BRCA, BRCA gene, and you can have BRCA gene 1 and BRCA gene 2. Those are the popular ones, but there's so many others. But what is called the penetrance, the risk, there's some other genes where the risk is not as high and they're not known about. But for any man who has so many female relatives, when they come to have the test, all those minor genes are also tested. But the most important one, or the well-known ones, are called the BRCA, BRCA1 and 2, like Angelina Jolie.
Thank you. Any more questions? Anybody with their hands up? Tony, I can't see it from my screen, so I don't know if you're able to see anybody, you or Sister Dolly. So another question is male breast cancer. I remember having a cousin and she mentioned how painful it was having breast cancer.
Okay.
So is it similar in men, the complaint?
It's essentially the same thing, yeah. Although for majority of women with a very small lump in their breast, it tends to not to be painful. But when men, because the breast tissue is not that much, if they leave it for too long, if it then get attached to the chest wall, when they move or when they stretch, then it can become painful.
Thank you very much. Any more questions? I think Comfort has raised, a person has raised their hands. Comfort, can you unmute and ask your question, please?
Thank you, Olga. I don't know if you can.
Welcome from South Africa, all the way from South Africa.
Awesome, yes. I don't know if you can hear me because we got load shedding this side, so it's the network is a bit wobbly. And the question is very straight. Can you, because I've actually attended the meeting a little bit later because I was busy with something, but can you please allude, I know maybe you've went through to this, can you please allude, how do we as men, because I know that with women, you can actually, in terms of searching the breast cancer, there are certain things that you should do.
Yes.
That you can feel the lump or something like that, you know, or either you raise up your hands, then you can search with the other hand and so forth. But when it comes to men, how do I examine myself, look at myself in the mirror, or do I do the same as touching and look at things, feeling some bump, or what do we do, you know, in terms of that case? Yes.
Okay. Okay, so Comfort, yes, I did talk about that earlier on, but simply it's a case of using the flat of your hand. So if you use the flat of your hand and you just put cream or soap, and then you just examine your chest wall by going up and down, and then you raise your hand up and you examine under your armpit. If you do that once every month or once every 3 months, that's actually adequate. You really shouldn't be able to feel any lump under your armpit or your breast. If you can feel something and you examine yourself a week after and there's still something there, particularly for men, if it feels like a stone, if it feels hard, like a pebble, then you need to be checked.
Are you happy with that answer, Comfort?
Yes, I am. I'm very much happy with that answer. Now I know what to do, because we actually this month we on a men's, you know, thing in South Africa. So it's very much essential because I'm going to share with other friends of mine that it's very much essential for us as men to do that as women do that. So yeah, thank you very much. I've got the answer. So yeah, awesome. I'm going to share this information going further.
You're most welcome. Thank you so much. And another question is there hope for cure soon?
Right. Okay, so that's a common question we get asked in clinic, and cure is in quotes. But the good thing is with breast cancer, it tends not to be as aggressive as other cancers. So yes, you can cure people. The number of new cancer cases is very high, but the number of people dying as a result of breast cancer is relatively low, which then means a lot of women who've had treatment for breast cancer actually live for a very long time. Some of them actually die as a result of other things. So yes, there is hope.
Absolutely, because you mentioned prostate cancer and other cancers when you were speaking, so definitely.
That's right.
And another question, yes, Tony, thank you. What about treatment in men?
Treatment for breast cancer, whether man or woman, is the same. As long as the person is fit and well enough to have operation, they will get exercise to remove, as long as it's possible to remove the whole thing. And then, as I mentioned, it could be a case of radiotherapy with that, hormone therapy, or even chemotherapy. And there's a new drug nowadays called Herceptin that benefits about 15 to 20% of those with aggressive type of breast cancer. So yes, surgery is the commonest treatment which we use to treat breast cancer, both in men and women.
Thank you very much. Another question, is there a connection between prostate and breast cancer or just in the gene?
So there's no direct relationship, but those who have abnormal gene, the BRCA gene, they tend to have so many different types of cancers in relatives, and prostate cancer in men is one of those. So it tends to be breast cancer, ovarian cancer, prostate cancer, even thyroid cancer that's quite common in such families.
I think I missed a question here. Somebody asked, is painful nipple, is it a sign of breast cancer?
It's unusual for the nipple just to be painful, whether man or woman. For women, it's not uncommon if they're wearing very tight bra and then they're exercising the wrong way. But it's very, very unusual for a man to have painful nipple.
Okay, thank you.
If it's a woman, if the nipple then turns red or it starts to bleed, it could either be a sign of maybe skin condition like allergy or dermatitis, or maybe something they've used. If they can keep a diary and then try and eliminate things that way, they'll find that it would improve. If it doesn't improve though, then they need to be checked for a condition called Paget's disease of the nipple, but it's very rare in men.
Brilliant, thank you. Questions are coming in. Another one, I heard that some cancer are hard to detect. Which cancer are hardest to detect, please?
Now, okay, specifically in men, that's unusual. That's very uncommon because most men would have a lump. In women, about 15% of breast cancer, the lobular cancer, which if I show you here, so majority of breast cancer starts within the ducts, 80%, about 15% starts within the lobules, and then they're called invasive lobular cancer. And those ones can be very tricky. Although the woman can feel a lump, but when they go to the hospital to have the X-ray called the mammogram, it might not show. Some women have very dense breasts where everything just looks white. And that's the reason why it can be very difficult sometimes to diagnose accurately invasive lobular cancer.
Thank you so much, Mr. Bommie. Is there any more questions before I hand over to Reverend Dolly, who will close us tonight?
There is one question that
did I miss it?
You seem to have missed.
Which one is that, Tony?
is breast cancer in men preventable? If so, how?
Well, okay, so yes, all you can do is to reduce your risk. As I said here, this slide of mine, how can you reduce your risk? Exercise, keep healthy, reduce alcohol risk, and know your family history. That's as far as you can do, really. For men who have sisters or maybe 3-4 relatives under the age of 40 developing breast cancer, and then sometimes it's worth reading breast cancer. That's about as much as you can do.
Thank you.
Thank you so much to the doctor. And I think there's there's the last question that I just posted, which is breast cancer in men seems new. Was it missed before or a new finding?
Sorry, can you repeat that question, please?
I'll go for it again. It says breast cancer in men seem new, as in a new finding. So was it missed before or is a new finding?
No, it's not. There's nothing new about it. The only thing is people are not so aware. And because there are not so many men who develop breast cancer, the small number of men who develop breast cancer are very old men. And it's not something people talk about quite commonly. So that is why, but it's not a new disease in men at all.
All right. Thank you so much, sir.
You're welcome.
I suppose we don't have any other question tonight. So we just want to appreciate you, sir. First, okay, I think there's another question. I'm going to read that. Greater risk factor are age and family. Okay, it's just a comment. Thanks, Olga. So we just want to seize the opportunity to thank you, Dr. Bunmi, for this insight that you've given us and in-depth. And within the BEM community, like you know, most of us, we find it difficult to kind of join meetings like this, sometimes due to stigma, sometimes due to our religious bias, and we just think nothing can happen to us. But I think this is an eye-opener to us as we're praying. We need to watch and pray. So watch ourselves and be kind of conversant with what is happening. It was actually surprising to me when I saw the flyer and I'm like, breast cancer, men. And I suppose that's the same thing with everyone. So we just want, it's been so thorough and kind of very impactful to every one of us on the platform. We just want to appreciate you for the time and the effort to put this together. May the Lord bless you in Jesus' name. Thank you so much. We really appreciate the thoroughness of the presentation and the time taken. I will pray that the Lord will continue to nourish you in Jesus' name.